My dad had an interesting summer. He actually had a quintuple bypass surgery. He's had a healthy, perfect EKG every year that he's gone in to get his physicals.
Yeah.
Perfect EKG.
Yeah.
But what found his 5 hard blockages in his heart was a resting stress test. So he's been telling all his friends, you need to get the stress test because that's what's actually preventative. If you can find that.
Taylor Swift's in-depth interview on the New Heights podcast continuing to make headlines even after she announced a new album coming out later this year. But we want to take a deeper dive into that moment you just heard.
Yeah, Taylor opened up, as you heard, about the first time after her dad, Scott, underwent that quintuple bypass heart surgery this summer. She highlighted that specific test that she said helped detect the serious problem.
Now doctors are hoping this could raise awareness for other people with artery blockages. So joining us now to talk more about this is Dr. Lawrence Phillips and the Director of Nuclear Cardiology at NYU Langone. Dr. Phillips, thank you so much for joining us. So let's start with the first question. Let's set the stage. What exactly are those 2 tests mentioned, an EKG and a nuclear stress test?
So sure, and thanks for having me. Both of these tests are extremely common. The EKG is performed at visits all the time, and it's looking at the electrical activity in the heart at those times for the couple seconds. And it can tell if there's been damage to the heart in the past traditionally, or if they're regular rhythms. A nuclear stress test is a test that evaluates to see if there's severe narrowing in blood vessels that's causing restriction of blood to different areas of the heart. When we think about nuclear stress tests, there are 2 types that are done. One is an exercise test where somebody walks on a treadmill or rides a bicycle, and we take pictures of the heart before and after. But the other one is for patients who are not able to walk or have other reasons that they can't do it with exercise. We do a chemical stress test that some might say is a resting or non-exercise stress test.
Now, so these stress tests, why are they able to detect or reveal problems that an EKG may not see? You know, because I get an EKG for how many years, because I don't want to tell you what my age is. And I'm thinking, well, should I have this nuclear stress test? Do I need to have more things done? So why can that stress test tell me more than what the traditional EKG does?
Yeah. So in the stress test, what we're trying to do is look and see if with increased blood needs or requirements of the heart are the arteries able to actually provide that blood by dilating. So normal arteries are able to dilate, increase the amount of blood going to the muscle, and therefore able to keep everything healthy. But when there's severe narrowings in the arteries, that restriction in the blood flow is not often seen on an EKG alone if there hasn't been damage to the heart. So instead, you need to actually stimulate exercise, either by having them go on the treadmill or giving this medication, and then we're able to indirectly tell if there's been this narrowing in the arteries. It's a very important test, especially for patients who have risk factors for heart disease, who have restrictions in their activity when they're not able to actually walk as much as the typical person does.
Well, you asked that. Well, when and why doctors, we know why they recommend the test, but when exactly? For people listening at home, how old should I be? Just give us some details there.
Yeah, so it's actually one of the most common tests that gets performed in medicine. And it would be not as much a screening test for every patient to have, but rather to have the conversation with their doctor based on their risk factors, based on any symptoms that they're having, especially if they're having any exertion-related symptoms. So if they're noticing with chest pain when walking, shortness of breath, all these things that need to have further evaluation to find out if it's the heart that's causing it. And with this test, we're able to then have more information to really come up with the right treatment, be it medications, lifestyle modifications, or even, as in this situation has been reported, requirement of surgery.
I do want to ask you really quickly before we go, Dr. Phillips here, just to switch things up just a little bit. There are new guidelines concerning blood pressure, and the big takeaways is alcohol consumption. And I'm asking you very selfishly because I have high blood pressure. It's something I take medication for on a daily basis. And, you know, I want to have a glass of wine. So I'm trying to understand here, these new guidelines, can you tell us exactly what they are? And should we drink less or just not drink at all?
So that's a great question. And so these new guidelines that came out are over 100 pages long with lots of really important information based on the most recent studies that we have. And what that focus on alcohol is some recent studies that have come out saying that for blood pressure control and also prevention, that alcohol has a deleterious effect, and moving the recommendation from just moderate alcohol to trying to abstain. There's a lot more to the blood pressure guidelines, though, too. And I think that the take home overall is to expand it from alcohol to say that awareness is key.
Yeah.
So having blood pressure checked, making sure both in the doctor's office but also in the community that it's being checked, because it's a silent disease in most cases, and that you're looking at all lifestyle changes, so diet, exercise, weight, and then if you got all that taken care of and the part that you're not doing is having a drink, so be it. So go from there.
So that was a thumbs up to having a glass of wine on occasion.
It's like a little small glass. I'm going down. We actually, thankfully, we have great, medical staff here in our building. I go get checked all the time just to always, keep up to date. So I'm gonna go check and I'm gonna have my glass of wine.
He's not telling you he's got a new baby, so he needs to be around for a long time.
It's also true.
Dr. Lawrence Phillips from NYU Langone, thank you so much for talking with us this morning. Important information, and we hope that you heard something that informed you.